Hello and welcome to episode 30 of Loosely Related. Today is January 13th, 2020. I hope we're with you in your cars or on your way to work or wherever you are. I'm here in the studio, which gets upgraded every time. You see, there's all kinds of new things. I came today. I couldn't believe stuff. I was confused. Yeah. And I'm joined by my host here to the left, Joey.
What's up, everybody? Want to say thanks for sticking around. We are in episode 30. We have hit the 30s.
I don't have. I wished I had three arms for this one. I can't do this. I have to do this, right?
Right.
Just
yeah.
three. And I was gonna get a fake arm. That was.
I'm a little confused by the three.
I'm
so
there's
confused. 10 fingers. Look
10,
at that.
Yeah,
See, oh,
10.
I caught up. You know what? Wow, look at that. Yeah.
So
I'm slow today.
But
Sorry.
if you did 10,
I have to do 10.
Okay.
Yeah.
We've lost half our studio. Just fell down.
And that's it. Anyway, also I wanted to just say quickly. I wanted to say. Unfortunately, got a little bit of sad news yesterday. I wanted to just quickly mention it before we got into the episode. I don't know if we talk a lot about music on the podcast. Neil Peart, the drummer for Rush, unfortunately passed away yesterday at 67 years old. One of the greatest drummers of all time. He passed away of brain cancer. I just wanted to say that thoughts and prayers going out to his family right now, and I really loved his music and. I'm sure he's been an inspiration to millions of drummers.
Yeah. I never hear a top list that doesn't mention him.
Yeah, exactly.
We were talking about him yesterday. We were down here yesterday. Joey and I continuing some of the touch-ups for the for the studio upgrade, and he was telling me all about it. And we sat and listened to Rush tunes last night.
Listened to the whole playlist. So anyway, so I just wanted to say that. And
nice. All right, and to my right is Joe, the man with just two arms.
Yes, I only have two arms. Unfortunately, I can't, bring it to you the way I want to bring it to you. But yeah, episode 30 is pretty cool, man. We're in the triple decade now of our episodes.
Oh yeah, that's a good way to look at it. We're
triple decade.
We're in the if you were 30 years old, which I'm almost 30 years old, you would say that it's the downward slope for the rest of your entire life. That's what it is, right?
Yes, pretty much. You're over the hump at this point.
30 is the downward slope. Joe must be on the bottom of the hill, just covered in he's 4 out of the 6 feet deeper.
It depends on which life you're talking about. I don't know which lifetime I'm in, but
that's true.
Yeah, and in addition to the upgrades that we have, you're probably seeing Joey in a different angle on a different camera. So we have multiple cameras working today, man. Thanks to our producer, Brian, man.
Yeah.
And then,
Brian's doing all the movie magic for us, right?
Movie magic. The luckiest man in show business. He gets to see us times 3 cameras is Brian.
Yeah.
Hey.
How you doing today, Brian?
Ooh, boy, it's been a week.
It has been a week, man. We got a lot of stuff to talk about today, right, Rob? We got some good shit.
Yeah, we're going to really do a lot of unpacking. Today's going to be a show of hopefully you'll actually learn something today.
Yeah.
I know we're usually we don't.
I can't promise you that.
Yeah, right. Let's take that back immediately. Today, hopefully you will learn something.
Yeah.
We were just all talking recently about the new year, and everybody starts to talk about doing their. Resolutions, thank you.
Yes.
My resolution is to remember any word. I got to hold on to some words so I can use them on the show.
Yeah.
So resolutions, and I think most people think about what? What do you think about when you think about resolutions?
I mean, I think weight loss is a big one, right?
Weight loss,
any kind of getting, just getting back into shape. If you're just maybe not trying to lose weight, but you want to get back in shape, you want to get running again. A lot of people take that time off, stuff like that. Yeah.
All right.
I think about which resolutions I'm gonna make and then not keep.
Yeah, right. That's basically
what we say that in jest, but it's really true. A lot of people, right? It's difficult to make a resolution.
Yeah,
right?
for sure.
You have to be resolute.
Yes.
Which in itself is difficult.
Exactly.
Yeah.
So that's what we're going to be kind of unpacking today. We're going to be talking about health and wellness in the new year. I don't want to be too somber, but it is, health is pretty serious, and hopefully you'll learn something today.
Yeah.
I've just been so busy in urgent care lately and in pediatrics, just seeing a ton of flu right now is extremely prevalent. Really? It's prevalent in New York State, I know.
I got my shot.
Did you? You got your shot?
You got a flu shot?
You saw about that flu shots today?
I got to do that.
I can't remember the last time I got a shot.
Got a flu shot.
Yeah.
Hey, listen, that's exactly why we're talking about it today. If everybody believed in it, it wouldn't be too interesting a topic, right?
Right.
Yeah.
Yeah.
So we're going to be talking about dispelling some rumors and myths about flu vaccines. We're going to be talking about asthma exacerbation, RSV, bronchiolitis, and upper respiratory infections. When should you go to see a provider, right? When is it worth it? How do you know it's time to go see somebody, right?
Yeah.
And then also I thought we would talk about just some general well-being tips on how to maybe keep those blues away, that seasonal affect disorder,
Yeah, man,
right?
it's tough.
Yeah.
The freaking Northeast up here, I feel like I know like a lot of people always kind of make that joke where like I feel like they always say, oh well, I'm hibernating for the winter. I
Right.
stay indoors. I don't really do anything. And it's like, yeah, it's funny to make that joke, but you don't realize that even just telling yourself that, I feel like you're sort of psyching yourself out. You're kind of like getting yourself in this mindset where you're just going to be locked away for 3 months out of the year. And you're not just doing damage to your physical health, you're doing damage to your mental health as well.
Yeah,
Right,
but that
absolutely.
brings me back to the resolutions again, because
Yeah.
you're talking about being depressed up here. Leaves fall off the trees and everything looks so gloomy.
Yeah.
And we didn't have a lot of snow yet and all that stuff. So you want to
We've
keep
had a lot of
yourself
wet
occupied.
weather.
So I'm going to bring it back to my resolution. My resolution is actually to build the best podcast in the
Oh,
history
look at you.
of podcasting.
Yeah, there you go.
So I just keep myself busy building stuff in here.
That
and
seems-
I don't
that's
think,
true.
I don't think about
Self-serving.
how depressing it is out.
Yeah,
related
there
to
No,
you
no,
go.
that's,
stuff. There you
that's
go.
an excellent point, though.
Yeah, it is.
And that's a good resolution.
Do
So
something
did you
you
make
like,
any resolutions
Keeps
this
you
year?
busy. Yeah, I mean, well, we had talked about it on the podcast before. I had recently lost a lot of weight, and I, obviously, it's always about trying to stay in shape
I
and
gained it.
keep the weight off.
I found it and put it on my body.
Yeah, Rob found. I lost it somewhere. Rob said, "Oh, I found it. Can I just keep it?" I was like, "Yeah, I guess so. I don't need it." But anyway, but I also wanted to start maybe exercising a little bit more and get back out there. But the other thing I really wanted to start getting into is also more taking care of like my mental health, trying to do things to help reduce. I deal with a lot of anxiety
Yeah.
and things like that. Personally, I know I've heard like meditation works really well. I've been trying to get it maybe into like I know like a lot of people highly recommend like CBD oils and things
Yeah.
like that. And
My
Isn't-
wife's into that.
I'm
too.
trying
I
to
was
look
going
into
to
that
say,
more, trying to
isn't
help my anxiety.
I thought your mother of your children, the porcupine,
Yeah.
is actually
I
teaching
thought the
her
porcupines
kids
were
that?
the babysitters.
The
not
porcupines were the
mothers.
babysitters.
Oh, the
I don't know
babysitters.
when
I'm
this
worried.
whole this is
When
getting
did it
into an
switch?
area. Yeah,
I
this
thought
is-
that we
yeah.
said that last time. I'm like,
Yeah,
they're just babysitting, which is
All right,
kind of
but
strange
I
enough.
thought he said that last time too, and I was like, "Whoa, listen, we're not married, okay? I'm no.
I didn't say you
about
were married.
You
bestiality
can't
on
put
this
no
show.
ring on this finger. You said mother.
I said mother. That didn't say means you're married.
Well, that's
the-
even worse. God, look at it is getting progressively worse.
sleeping
Now
with
it's adult.
porcupines out of
Look
wedlock.
at this.
But my point was, aren't they doing that meditation stuff? I thought you were teaching. Or
This
somebody
sounds like
was
an episode
teaching
of Rick
them.
and Morty.
it really does. I don't.
We're not even drunk yet.
Yeah, we're not even drinking yet.
I'm
That's the whole
trying
thing.
I'm trying to placate the PR fans in Bangladesh.
Oh,
which we
okay.
have, so
I
let's
see. I
bring
see.
it to them a
We
little.
do
I
have
see.
some fans
That's
out
good.
there.
We do have that one
I'm glad
guy.
that you're looking out for him.
Yeah.
But no, I'm actually glad you brought that up. Joe.
Yeah.
A lot of people, and I don't want to make it into a sexist thing because it's men and women, but I do feel like, especially certain nationalities, certain ethnicities, particularly of the male persuasion, it can be difficult for them to admit that they have anxieties
Yeah.
or seasonal affect, whatever you want to call it, some depression. So I'm glad that we'll be touching on that today, and I really do hope that we'll have some bits of advice that might help somebody. And
Yeah.
if you're somebody who is suffering from that, please don't hesitate to reach out to somebody, talk to anybody.
Right.
See a mental health physician, see a provider, see a friend. Just call somebody and talk to somebody if you're having any of those issues.
Yeah.
Brian, I'm sure you'll be able to post something, right, where people can reach out
Yeah.
if they're feeling depressed or hopeless or...
I'll find some like good links,
Okay,
not just
well,
like blanket stuff that people put up.
Right, exactly. Of course, like someone's personal blog or whatever. Which is no offense. I mean, like there's good advice you can find everywhere, but I think a lot of people, there's so many so many different avenues I think you could take that a lot of like some people when you want to deal with anxiety or depression, they just recommend all exercise. I'll just go for a run, just work
Right.
out, and that's good, and it works for a lot of
absolutely.
people. But there's a lot of other things that unfortunately that a lot of that exercise does not work for some people, and maybe they're not doing it correctly or whatever it is, and of course, and then some people can't really exercise. If you have
those
certain
are great
injuries,
points, yep.
yeah. So
Yeah, it's not easy for everybody. And don't
Right.
forget, some of these people, I think this is something we all overlook, and I don't want to go down that rabbit hole too far because
Right.
we'll talk about it
Yeah,
later.
right.
But just like, if you live in a really horrible neighborhood, do you feel safe? Especially if
Right.
you're a young woman or a male, do you feel safe running in the middle of the night when you're afraid to be mugged or something worse?
sure.
So, Brian, what about you? Did you do any New Year's resolutions this year? Maybe he'll think about
I
one.
got one. I'm writing a short film I want to shoot in spring.
Oh,
Nice.
wow, man. That's awesome, man.
I'm putting it on myself to finish the script.
Good.
I'm like 7 pages in right now. It's like a 20-page script.
20-page script?
Do you
Okay.
think that might take any time away from this? Because this is kind of important.
Yeah,
Yeah,
right.
no,
This is
no. We can help you. We can maybe help you with that. Maybe
Yeah, sure.
We'll be part of that short film somehow.
Maybe it'll be how
we'll do it behind the
these
podcast.
four nobodies became a podcast of power.
Yeah,
Yeah.
exactly. There you go.
Yeah.
Oh, they call me a young Morgan Freeman, Brian. So if you need me to narrate, I can
narrate for you.
Give him a little taste, Joey.
I think we're on a streak.
And
I think
Brian is making a film, and this is something that we all spend time.
I think we're on a streak. I think we've mentioned Morgan Freeman on every episode.
3 episodes
for the, at least
consecutively, I
yeah.
think.
Nothing wrong with that.
That's
Yeah.
good.
I think we go up 10% in popularity every time we say Morgan Freeman.
Exactly.
Yeah.
All right. So, having said that, let's go ahead and just start unpacking some of this health and wellness that we were talking about. Specifically, like I said, I've been working in with pediatrics for a while now, is particularly in urgent care.
Yeah.
And I see a lot of the same things being done. And you might hear us say some medications, some recommendations today. Please, here's that disclaimer. Some of us here are to some degree healthcare professionals, but none of us are providers. Please never decide to take a new medication or to change your medications based on anything you're hearing today.
Right.
Call your provider. Talk to your personal physician. Do not say, I heard on Loosely Related podcast I should dump all my meds and
Yeah.
start eating broccoli and sauerkraut.
Exactly.
No, that sounds like good advice.
Yeah, exactly.
I completely
solid.
trust Loosely Related's advice. So
There
whatever
you
you
go.
tell me today, that's what I'm doing. Even if I'm not sick, I'm going to go get that medicine.
Yeah, exactly.
All right. So in order to talk about what you hear a lot about this time of year is those upper respiratory infections, right? And there's like a grouping of them. So I just want to give you a very quick idea, like what you mean when you talk about upper respiratory. We're not going to go into all kinds of details here.
Yeah.
But I feel like just having this basic understanding of functionality of your body will really help you make better decisions when it comes to like when is it time to go see a provider?
Right.
Because that's such an important question.
It is.
All right. So you have your nasal cavity, your pharynx and your larynx. That's all the way in the back of your throat there, where viruses such as the flu kind of sit around.
Yeah.
In that nasal pharyngeal area. Then you have what I would call the midline area, so your trachea.
Okay.
Everything below that becomes your lower respiratory area, and a basic rule of thumb is as infections get down there, they do become usually more serious.
Really?
Yeah, so like your pleuritises or your bronchitis, right? Then you're talking about the bronchi, that's in the upper lung area,
Bronchitis
right?
sucks,
And then, right, because it becomes difficult for gas exchange. We're not going to go too into that.
Yeah.
But the reason I want to kind of give you this idea, that mediastinum, let's just imagine it as a box. The mediastinum is a lot
Okay.
more complicated than this. But let's just say it basically houses your lungs,
Okay.
your heart. The sternum is the superior outside of that area.
Yeah.
That sounds
and then
important.
the inferior, yeah. It's pretty important for breathing and for sustaining life.
Right, of course.
So-
Absolutely.
Definitely need
Life.
that.
And
Yeah.
then the inferior part, or the box bottom, I guess, would be your diaphragm, which is your major muscle for breathing.
Okay.
So a lot of times when you have sniffles at home, your kid has sniffles or whatever, especially if you're new parents, you'll tend to rush that child in right away to a doctor or an urgent care or something. And I totally get it, right? You're worried about your child, of course.
Yeah.
But some things you might want to consider is does the child have fever? Do they have GI involvement? Do you think
Right.
this is a flu or just a cold? Because you have to consider when you're going into these urgent cares, there's a ton of more severe illnesses going on.
Right, you're
Right.
exposing them to all
You're
these
really
other
exposing
issues,
them, right? And one of the first things I always say is go call. You can call. You have a phone. Call your provider and say, hey, my kid or I or whoever you're concerned about has this, that, and the other. Do you
Yeah.
think that we should be seen, or should we wait a little while? And I'm not saying delay healthcare. If you're worried about it, you could always be seen.
Sure.
So, but those upper respiratory infections, those are like nasal obstruction, sore throat, tonsillitis, pharyngitis, laryngitis, and you see
Right.
all the itises.
Yes.
Those most of the time, for rule of thumb, are not that severe.
Really?
Okay.
Oh, okay.
Some of them do need treatment. Sinusitis can get serious. You can get sinus infections. Those are serious.
Yeah.
Pressure behind the
Got it.
nose, under the eyes. Right.
Every
You know
other
what I'm
day.
saying.
We'll get into that in a little bit.
Okay,
I
so
deal
you
with
know
that.
what that's about.
I mean, well, that's my whole thing. I mean, I don't want to hijack your.
No,
your
go ahead.
thing, but like for me, of course, like upper respiratory. When you were talking about wanting to talk about this, like I deal with this all the time. So
Mm-hmm.
I have pretty severe seasonal allergies, and I deal, like my sinuses are always like out of control. I feel like there was a time period there where it was sort of a running joke in my family. Every other week I was at the urgent care facility getting some kind of antibiotics, and then of course it's like you realize that it took some time to realize that there was a difference between me just having sort of like a flare up, like my sinuses are bad, and it really becomes like a legitimate like infection, because I was on antibiotics all the freaking time, and I didn't like that either. But I dealt with it constantly. The pressure behind the eyes, a sinus headache to me is almost like a migraine. It's so bad.
It can be pretty serious. Sure.
I whatever I can do to just stop the pain. It's so bad. It's pushing on my eyes, pushing on my face. It's like it's the worst.
You just want to take your whole head off, right?
Yeah,
and replace it with someone else.
Please rip it out.
Go to a mechanic.
Yeah, exactly.
Well, you brought up a couple good points there.
Yeah.
One of them is antibiotics. There's a lot of people who feel pressure to give antibiotics even when it's not really necessary.
Right.
Because they want to fix, and a lot of times antibiotics aren't necessary. You have the flu. Antibiotics don't do anything for that.
Right.
I wanted to touch on something like that, because now I touched on the scam. Like you brought up the thing about mechanics and scams and stuff like that.
Yeah.
And I'm not saying all, but I've heard it said that a lot of times that there's incentives on behalf of the doctors or nurses, not nurses necessarily, but the doctors, people who prescribe medication when they're looking at people, that there's incentives by the drug companies to try to,
Like push
those
I have a
types
story
of
about
things.
that.
Even if
That's a good,
sometimes if the person
concern,
doesn't
right?
necessarily need it, or not necessarily medications, but maybe just drugs in general, and they try to get. Is that true? Is that
So what I
happening?
can say is I have personally never worked at a facility where that was even
that's
mentioned.
right.
However, you do get reps, and I'll tell you a lot of times there's so many stringent rules on what a rep can and can't do anymore. Like
That's good.
Like a lot of times they would literally back in like the 90s, they would take doctors on a cruise line to talk about like Viagra or something.
Right,
like that.
right.
Right.
So certainly at one point there might have been, but I think those days are gone. Honestly,
Good.
Yeah.
Where that was an incentive. Most of the time they don't want to give out antibiotics when they don't need. A lot of times it's pressure from parents. Think, oh, my kid needs an antibiotic. Even if they don't, they feel pressured to give it. Otherwise, they're going to get knocked for not giving good care.
Yeah. All right.
So I have a clarification question. Is this sketchy or not? So when I was living in Los Angeles,
Yeah, that's sketcy.
Yeah, I agree with
sketchy.
you. Unanimous. Sketchy.
so yeah, I had at the end when I was about to graduate, I was in Los Angeles. I had this experience, and I didn't know what was wrong with me. I knew something was up physically, but I wasn't sure. Turns out it was really bad panic attacks.
Oh, wow, Brian.
Yeah, it was it went on for a few months, but I'm over it now, obviously. But what do you call it? I went to this urgent care to be okay, I need to I don't know, I just need to go to a doctor just to make myself feel better. And no prior history of anxiety I've ever had. There's no records that say I've been given prescriptions before, treated before. I walked away that day with a prescription for Valium.
Really? Wow.
Yeah, so that's the kinds of things.
Now, how long ago was that?
This was when did I graduate? I want to say spring of 2018.
Okay.
Wow, that really surprised me.
And I got it for under $1 because of the health insurance.
Yeah, it's not expensive.
Yeah,
So
I'm
I
talking
literally
about-
could have been a drug dealer.
I'm talking about more of those types.
But
of things,
no, I mean honestly, there's been a lot of things done actually to really get rid of that, and sometimes it's 180 so much that it's actually to the detriment of healthcare.
Yeah.
I can tell you, there's a lot of places I work at, and even if it's needed, they won't even give it for a day.
Yeah.
But it's because I think it's been so overly abused, and a lot of them, they might not even have a rule saying you can't do it, but they'll just say it is to get pressure off of them from a patient.
I was
Right.
shocked.
But
Do you have any more
or
of
they'll
that
just
Valium
treat
left?
No, see the thing is I didn't want to take
oh,
it.
you're
'Cause
so
I'm
relaxed today.
I'm
Joe.
this is not. I don't know if this is sketchy or not.
You weren't really ready for it, too. That's
No, that really is a surprise to me.
Yeah.
And the thing is, there are warning signs for that too. It's you'll see some people, and I think I really feel, and I'm being as earnest as possible, I think they're trying to get rid of the old school provider mentality, because there were people like that who would put you on an anxiolytic or a benzodiazepine such as Valium or lorazepam or
Xanax or
diazepam,
whatever,
right?
Yeah.
Those medications work. Absolutely, they work. But they also come with a large side effects and addiction,
Yeah.
I've
high
heard that
addictive possibility.
Xanax, Rob, maybe I don't know if you could speak to this, but I've always heard that people who use it very frequently, it can have a rebound effect.
Sure.
Where the anxiety comes back.
Can be worse.
Yeah,
Almost
because
once
you
it
become
wears
almost
off or
dependent on the
whatever.
drug.
You become dependent. You need more of it.
Yeah.
So
Or
some
you
people
need
take
another
bars
drug.
of it in milligrams. It's insane.
Or you become, it makes it. It's what do you call those drugs that make you start taking another drug? There's a word for
Like
it.
Gateway
the side
drugs?
effects of
Like a
those,
gateway
or-
drug to start. You start taking Valium to get come
Again,
down. And then you
I
have
I
to
don't
take,
think I think it's you start at like weed and then work your way.
Yeah,
I don't know,
yeah,
but
it's a
I
little
think
bit
like
different,
people,
I think.
in Hollywood, you're talking about California and Hollywood.
yeah.
How many Hollywood actors and actresses, musicians have died from overdoses of sleeping
Yeah.
pills because they're
Sure.
taking amphetamines during the day to keep
Oh, yeah,
going,
yeah,
and then
right.
they're taking
And then
sleeping
they
pills
of
well,
course,
that's
right.
yeah,
to go to
yeah.
sleep at night.
Right.
And it gets
You
worse
see
and
that
worse
a lot
and
with
worse.
ADD meds that people abuse those and take Xanax at night or lorazepam at night to go to bed.
That's what
Yeah.
that kind of stuff.
Yeah, it's
Talking
like
about.
back and forth. And
Yeah.
don't think that doesn't confuse your body. What do you think your body's going through when it's like up,
Yeah,
down,
up,
Right,
down.
right,
up,
right.
down?
Yeah.
So the thing, okay, so one thing to look out for. You ever see anybody, those are short-term medications. You're going on a flight somewhere, 100%. Lorazepam is a great medication for that. Someone that has bad anxiety. You shouldn't be prevented from going somewhere like because your anxiety is so bad. And I know what that's like. I know it's like to be immobilized by anxiety.
Yeah, same.
You have to live the life. So absolutely, those medications, there's nothing wrong with taking that medication to do that. Or you have a one-time thing that you have to do it and you need that medication. There's a problem when you have general anxiety and you're taking a medication like that for 10, 12, 15 years. That's a
Right,
problem.
exactly.
I-
There
I'm
are
so-
better ways to handle that.
Yeah.
I'm so intrigued by the fact that I know all
Yeah.
three of you guys. I know my son, my wife, my daughter. No, my two sons, my wife have anxiety like crazy.
Right.
And I don't understand that. I don't understand the.
Because it's never been really affected. by it.
I don't get it. I mean, I get anxious, but when I'm like Joey said the one time, if I'm anxious about something, it usually
Yeah,
means
it's
something
bad.
bad.
Yeah,
right?
yeah.
But I'm usually just calm about things and try to be, think more pragmatic about things. What is it that makes you guys so anxious? Like, what is it that spurs it?
I think a lot of it's genetic, right?
Yeah.
Most things are
I
genetic.
mean, it's just a worry, maybe like.
Well, I
worrying
think
about
what
shit?
I think what you're misunderstanding is that it's not necessarily a thing. I think that you're thinking of it like it's like a stimulus, like it's some kind of stimuli. I think what we're talking about, it's like literally biologically. It's not
yeah,
anything
it's
that
like
we necessarily have.
physiologically or something like that.
Well,
or
like
just-
it's like Rob is saying, like it's like genetically your body cannot maybe. I mean, Rob is I'm not a medical professional. Rob is. I mean, I could say like your body just can't really deal with certain types of external stressors and things like that. That
Right.
you, in the way that maybe someone who doesn't have anxiety, at least to the degree that you have it, can deal with it. And so it's not necessarily even like one particular thing, because like one thing that might trigger me. Might not trigger Rob, so it's not like there's one thing that triggers everybody exactly the same. Obviously, everybody has different.
But in
things
general, is it
differently.
like worrying that triggers it?
Well,
mostly?
I
I
no,
think the
Or is that the
definition
same-
of
one and the
anxiety
same
is different,
thing?
right? So there's fear.
Yeah.
Fear means you have a direct result of something. So like Brian one time was down here and he had that giant wombat animal thing near
Yeah,
us.
right. There was like
That's
We're not
fear.
really sure if that was
Right.
I don't know what that thing
originated
was.
on Earth.
Yeah.
Yeah.
I don't know what that. It looks like alien, like
Yeah.
in nature, but that's fear. I don't
Right.
want that thing near me. That's not anxiety.
Yeah.
Anxiety is a general thought of being worried, but you're not even specifically sure what it is normally.
All right, so
It's just a
you're
general.
That's what I'm
you're just-
saying.
You're
That's
just
what I'm saying,
like
exactly.
nervous, like you're on some kind of drug, and you're just like
Right now,
jumpy
normal
or
anxiety.
upset about
There's plenty of like general anxiety that's good
Yeah,
and
normal,
beneficial.
yeah.
So,
Right.
for instance, Joey, you're a graduate student, right?
Yeah.
You must have tests that are coming up.
Absolutely. I have, if I have a big paper coming around, the corner, obviously I'm going to be worried about
Right.
it.
And
Yeah.
what gives you the impetus to study and work hard?
Exactly. Is me being worried about
You're worried
doing
about-
well and
yeah,
about
you don't
my
wanna
grades,
drop that
and I want
test,
to be able
right?
to do that. Yeah, exactly. Yeah.
Right. So that's normal.
Right.
When the rest of the world becomes like small around you and you have no peripheral vision per se, like all you can do is focus on that one thing that's given you, that's a problem. That's
Right.
when you should see somebody or talk to somebody.
Okay.
When you notice that problem becomes your worldview,
Yeah.
and everything else starts to shrink.
Right, and you start to forget about everything at the expense of everything else
Right.
around you, sort
Yeah.
of.
Yeah, like the best way that I can kind of compare to that is like I used to have real problems with hypochondria. I used to be like I
You
still
used to.
I still not
He
nearly.
thinks he's dying right now.
I mean, no, it used to
At
be.
the end of this, we're going to have to commit him after this episode with all this stuff we're talking
it
about.
used to be like paralyzing. Like it used to be to the point where I had it. Like every now and then, I may have certain little flare ups where I worry about things here and there. But I've really overcome a lot of it. Like it used to be to the point where I would be so terrified of like literally just catching anything that I wouldn't get out of bed. I wouldn't leave my bedroom. Like it was literally that bad. And a lot of it was from, and I've talked about this before about like looking things up on those like WebMD websites. I don't even I don't even go
That's a
on those
whole-
sites anymore. I completely cut that out of my life.
That's
It's just
good. That's good.
Complete joke. But that was like that kind of anxiety where it was literally like debilitating. I could not control that type of hypochondria. It was just
Yeah.
it was like
but now that was
couldn't
just
control.
that was
That's definitely
triggered
a
by
mental
your,
disorder.
Yeah, okay, so that is
100%,
probably
yeah.
a mental disorder, but triggered.
I don't mean to put like a label on
Yeah,
it.
no, for sure.
But that's-
You know there was something wrong with
Yeah,
it.
exactly. So that's why I tried to, made a change
Right,
in
and
my
you-
life and all that.
Exactly.
But that's triggered. But
big.
now, is it fear though? Because you're fearful that you have an anxiety, you
But
have
that's
a
what- again, like,
symptom
that's
or
what
something,
anxiety
and you start
pretty much
freaking
is.
out about it. Whereas Rob's saying the other one is where you're just focused on something and you don't even really know why, right? I mean, so it's kind
Well,
of
there's
weird.
some things that you could do to help. So, for instance, he in Joey's case, he was able to say, "Hey, this is one of the things that are really triggering me, and I know I need to cut this out." The looking on the WebMD.
Yeah, the WebMD was a
Yeah,
big.
yeah.
Which a lot of people, you'd be surprised how common that is.
Oh, my God.
We all do it. I've done
Yeah.
it. I'll
Yep.
get a little rash, and I'm like, "Oh my God, what is this rash?"
Yeah, exactly.
Or you have something, you're like so fearful to get something serious, or you heard about someone roaches in my mouth, and they're like, I'm never eating at Taco Bell. But
Exactly.
seriously, like,
Oh,
those are
stubbed my
types
toe.
of things,
Oh,
right?
yeah, you have toe cancer.
Yeah, absolutely. And then don't think it's like sometimes a little bit of knowledge like professionals have make it worse on them.
Yeah. Oh, really?
Sometimes.
That
So
sucks.
the thing is like that's why you go out and get help from someone else who knows that. It's like trying to deduce yourself is terrible. Like, so for instance, I work with peds all the time. I get a million questions a week about what's wrong with my kid, this and that and this. It's different when someone in my home asks me. You know
Right.
what I mean?
Yeah,
it's
of
like,
course.
I don't want to deal with my own kids in that way.
Yeah.
Simple things like I was talking about the upper respiratory, sure. But like when it gets more serious, I go to the pediatrician. I'm not a pediatrician.
Right.
You know what I mean? I'm not
Right.
going to just start let someone's health and wellness.
Yeah,
I'm going to just
yeah,
start,
right.
hey, I'll cover this.
Yeah,
but,
exactly.
So getting back to that, I'm going to kind of go. A lot of
Yeah,
this is
yeah,
like we're
yeah.
getting a lot of good ideas and
Yeah.
a lot of stuff's coming out.
Yeah.
So I don't want to hamper the conversation by going back to this too long. But just a couple of those things that the flu is really out right now. It's really
Yeah, that's
very
the big thing
prevalent.
right now, yeah.
Which type is that right now?
There's the two major types are flu A and flu B. Normally you see one and then the other following in the season more, but I've actually seen quite a bit of both.
All right.
So both A and B. And so the only thing I really want to talk about the flu is to vaccinate or not. I know that's like a
We covered that
divisive
once
topic. We did.
on a past episode.
We did talk about that, but the reason the flu one is coming back up is I still hear the same like myths perpetuated over and over
Yeah,
and
right.
over again.
You would think they watch loosely related podcasts
Yeah.
and they
Yeah.
wouldn't believe
They would
that
just
we
watch
have any
us.
of those
Exactly.
anymore.
Dispel those rumors.
And they wouldn't. Yeah, it wouldn't come to you.
But here's just a devastating story. I mean, 22-year-old female in the area near where we live here, over in Newburgh, she died of complications from the flu. 22-year-old female.
Yep.
Ended up with multiple heart attacks and brain swelling.
Right.
Yeah.
Terrible.
Now it is suspected, and I know that there's a family member of my colleagues right here that know the person, but I don't want to speak to that because I don't really know.
Right.
Yeah, exactly.
But it is suspected she had some kind of underlying issues or
Yeah.
conditions.
She had conditions, and the flu exacerbated the.
Right, and she only
situation.
had been diagnosed for one day. She went to St. Luke's. They were going to helo her down to Westchester, from what I read, and the weather was too bad.
Really?
She ended up
Oh my
at Good
gosh.
Sam by ambulance.
Oh, good, Sam. Okay.
And
She went into
uh,
coma, right?
Yeah, and she passed away.
That's terrible.
So
Yeah,
that
it
is
was
terrible.
It was very sad, yeah.
That is very
But-
sad. So, of
Young
course,
girl.
my thoughts, I'm sure people in this area who listen to this podcast probably know the name, know who she is.
Yep.
So, obviously,
We're very,
LRP's
very
thoughts
sorry, and
are
our
with you.
Thoughts and prayers are definitely
Absolutely.
with that family. It
It's
must
your
be so
family.
devastating. I can't possibly imagine what
Right.
you're going through.
Yeah,
Exactly.
no, absolutely not.
Yeah.
Nobody wants to see their child die before.
Yeah.
That's devastating.
So now, Rob, not to change the topic, but
Yeah.
the big thing about the flu shot that and I think this has always kind of like sort of stopped me from going. A lot of people I know, they say that it's such a silly thing, but I've literally heard this argument. A lot of people don't like getting needles, right? A lot of people are afraid of needles. I'm not saying I'm one of them. I don't love needles, but it's not like that big of a deal. But I know a lot of people are so afraid of getting needles, and then what they say is the argument I always hear is, well, I hate getting shots, and the flu shot is only like 30% effective anyway, so why am I going to put myself through that kind of pain for a 30% chance of not getting the flu or something like
Well,
that?
they're not afraid of
So
it.
I wanted to ask you, is that like something that you deal with? Like
Absolutely.
And then like the 30% thing, is that how accurate is that?
Okay, so the downside of the flu, right, is basically that it comes from ACIP, which is a very specific part of the CDC.
Okay.
Made up of different types of scientists and virologists.
Yeah.
And they they make some kind of formula. I don't know exactly. I have a
So
rudimentary
it's
understanding.
actually, it says on the CDC, it says 40% to 60%.
Okay.
Would be, and that's pretty good, honestly.
That is good.
46% is actually good. So if
No
you
shit,
figure there's
okay.
millions of people who
Yeah.
have the flu and 50% of them don't get it,
Right.
that's millions
Yeah,
of
true,
people.
true.
Yeah.
The other good argument is against that is like, well, so what are you going to do if you don't get the flu shot? 50% effective or 0%? You
right.
have nothing
right.
now.
Right. Of
Yeah.
course. Of course.
And
Right.
and the best argument against it is that, and doctor, I was just listening to a CMO and a pediatrician the other day. It's the people who end up with complications of the flu 3 times more likely that they did not get inoculated.
Oh, wow.
So the ones that end up with complications didn't get a flu shot.
Huh.
Yeah.
So that's really the end of that story. I mean, if you look at it that way.
Right.
Because even if you do get the flu, so basically going back to the story we had said before, you have those specialized cells, it's B cells, and they're memory cells. And what the flu shot is doing, it's showing a dead virus. It's not live.
It's
So
dead
again,
virus.
another myth, you cannot get the flu from having a flu shot.
Yeah.
Right. You had mentioned to me because a lot of people have that fear. They want to
lot.
Get
Yeah. I hear it
and
all
like
the time.
you said, I don't know if
Well, you had that fear for a long time,
No,
too.
no,
I know
no.
you try to act like you don't,
No,
but there were days
I
you
didn't
come
have
home, you
that
would
fear.
say-
I didn't have that fear.
There's controversy
No, I
here.
didn't care. I didn't have the fear. I always had the belief, though, that if
Well, whatever you wanna
it
call
can
it,
give
fear,
you the flu,
belief.
but or maybe the But there was a guy at work I was talked to, and he always said, "Oh, I can't." It always gives every time I take it, it gives me the flu.
Yep.
And then I spoke to you, and you said you don't get
Yeah.
the
That's a
flu
myth.
from the shot unless you already have
That's
the
an
flu in your
absolute
system.
myth.
Right.
So there you go.
What happens, it takes 10 days for inoculation to occur.
Right.
So if you get it today or whatever, we'll have our 31st episode out before you're fully inoculated. There's a good chance you got it because you were hesitant, so you waited. Now you see people with flu. You've already been infected. You go get it. Now you think you got it from the flu shot. But you've already been, you've already been exposed to it. So that's what happens a lot.
Right.
And again, going back to the ACIP, they are basing it on what was previously most common. So there's antigenic drifts and shifts, and we're not going to get into that. But basically, what it means is there's years where the
Come on,
virus.
let's get into that.
Look, oh, you want to get into it? You scared me for a minute. I thought you really.
I was
wanted that
looking forward
info.
to the antigen thing.
Antigenic drift. So some years it changes a lot, and some years it changes a little. And the years it changes a little, imagine we're giving everybody a triangle. That's what the memory looks like.
I
of
like
it.
triangles.
Yeah, you see, good triangle.
Exactly.
And that year the flu ends up being some kind of mutated triangle. It's mostly still going to work.
Yeah.
Right? If we're giving you this triangle-shaped virus and all of a sudden the flu looks like a rhombus,
Right.
it's not going to work real well.
Oh, I see what you're saying.
So
That's a good
because
analogy.
there's a bunch of different changes to it and a bunch of different strains,
Yeah.
it's impossible to get 100%.
Of course,
It would
of
be
course,
just impossible.
Absolutely, yeah.
that's-
And it's a virus. It's
You know
always
what I mean?
changing. That's
It
the whole point.
changes.
It's
It mixes with
literally always
DNA
changing.
and
yeah, of course.
both of mammals, birds,
Right.
humans.
Yeah.
All that changes it.
Exactly.
But the thing is, going back to it again, the 3 times more likely that you'll end up with a severe side effect or a severe bad outcome if you're not inoculated.
Right.
Secondly, it pinches so little. It's like the easiest
Yeah, it's
shot
a
out.
tiny
Yeah,
little.
I
get
give it to little kids half the time they don't
it's
even know
over
they
it.
got it. They're
Yeah,
like,
it's
"What?
over
I'm done
before
already."
you-
Exactly.
know
It
it.
shouldn't be a big deal. Yeah.
And they do it in the shoulder, I think.
Yeah, in the delta, right in the shoulder.
You can also get a nasal spray, right?
Yeah, now
another
that's
way to
come
do
back.
it.
Now that's something I would recommend not getting
Okay.
because that's live attenuated vaccine.
Oh, it really
That is a live
interesting.
attenuated
Interesting.
because it
Okay.
needs to survive long enough for you to get some
Oh,
immunology.
look at that. Wow.
And there was a year where that was 0% effective.
Wow. No
I would.
way.
I'm not going to lie to somebody. I would not personally recommend something that was 0%
Like they
effective.
Yeah.
All right, so you heard it here, loose related.
That's just my humble
just-
opinion. If you work for
recommendation,
whatever
yeah.
GSK or whoever's making that crap, don't get mad at us.
Yeah,
But if you
exactly.
do, email us at looselyrelatedpodcast at gmail.
Yeah. So,
But,
like, Rob,
yeah.
the other question is, would you? I know, like, one of the things they always say is that they especially recommend getting a flu shot or at least trying to, go to the doctor, especially if you have, like, underlying conditions, like an underlying lung condition. So, like, for example, I have asthma myself.
Right.
I also deal with, on top of everything else I deal with, all my seasonal allergies and all my sinus issues. I also have asthma. So for me, I know, like, I always I'm told by doctors, oh, you got to go ahead and make sure that you're, going ahead and getting your flu shots
Yeah,
because if you ever got the flu for someone like you, it's going to be especially bad because you already have underlying
Right, so that's
conditions.
exactly what we're talking about.
Right.
And to really put a little bit of a cherry on top.
Yeah.
Asthma's serious. A
Yeah.
lot of people think this is, well, it's just asthma. Don't get it twisted. If you have a severe flu with an asthma, you probably going to end up in a hospital.
Wow.
It's a
Yeah.
good chance that you're really going to be down for the count. The flu is not a cold.
Right.
People run around thinking they had the flu because they had a cold. I'm telling you, you have no GI symptoms. And those are the idea. Most people with the flu have a high fever. You're running around, you're mostly good, and you have the sniffles. You don't have the flu.
Yeah.
Okay, so stop
Yeah,
thinking
right.
you have the flu.
Right.
The flu is bad.
Yeah.
And it is worse some years. But like you're saying, the
course.
underlying condition of asthma,
Yeah.
you start getting that inflammatory process, right? So that insult or whatever it is, that little sniffles that you get or whatever, you get the virus in that nasopharyngeal area that we're kind of talking about starts as upper respiratory.
Yeah.
And then your body comes to the area, right? And inflammation starts. So you get that swelling of the tissue, that's the dilation. Right, it's expanding. Then you get increased vascular permeability, so that all those cells can get to the area to help fight whatever it is.
Yeah.
In this case, flu, right?
In that flu, yeah.
And they get the cytokines and the bradykines, and that increases fluid volume. They're signaling for more cells. So you get
So what does that increase of fluid like?
So those
are you
are
saying like you almost like drown like
that's where the
lungs
mucus.
That's where
I'm sorry.
And
Yes.
then you
Okay.
get-
Right. Yeah.
And then now that you have asthma, that starts perpetuating that bronchospasms of the soft tissue and cartilage that you get.
exacerbates
And
it
then,
even more.
you really have a hard time breathing. Now you have double this inflammatory process going on.
Yeah.
You start to get poric acid exchange. Then you have a risk of it becoming a super infection or starting to get down to that pneumonia, right? Or something serious like that.
Yeah.
Wow.
And you end up on multiple, not just viral stuff. Now you do have bacterial
now
issues.
you have bacterial infection. Wow.
So you really have to be careful about that.
Yeah.
So the thing with asthma is there's some things that you can do right now. I'm glad you brought it up. We might as well go right into that. So with the asthma, what you want to do is you want to already be prepared. You know that some seasons, especially you, Joe, you were just saying it earlier. You know there's sometimes a year.
Yes.
You're living in a valley. That crap is like just sitting, all the dander and the tree
especially
crap.
getting into spring.
Spring is the season.
You know exactly.
Well, actually falls the ragweed every fall, man, just destroys.
So you're probably very sensitive to that.
Yeah, exactly.
So what you need to do is consider, like, do you have hardwood or rugs in your room? If you have rugs, you need to be, like, fastidious about vacuuming. I'm talking about multiple times a week. You're really better off having hardwood.
Yeah.
Do you have forced air? A lot of people have forced air. That really dries out your sinuses and causes inflammation, which exacerbates asthma.
Wow.
So there's those triggers and allergies. That's what gets asthma going.
Right.
Routine showering at night. I can't tell you enough. I always tell my little guy, he's 7 years old, he never wants to go in the shower. You have to shower every night because you have that crap on you. You go into your bed, you don't see it.
That's
right.
Then it gets into your sheets,
and it's there,
and it's there. Right. And you go to
yeah.
bed thinking, "Oh, I'll get good rest. My body's." You're not getting a good rest. You're coughing all night, even if you don't realize it.
Right.
Your family realizes it.
Yeah,
you're coughing, not
true.
getting good sleep. Which brings me back to this: a lot of people think that asthma is the wheezing is that poster picture of what an asthmatic sounds like, right? And that's that swelling that we talked about. So you get a small little airway. Say you're breathing through a straw, right? You take a straw out of your soda, you're breathing through it. Now all of a sudden it feels like you're breathing through a coffee stirrer. You can imagine what that feels like to an asthmatic trying to get air to this little tiny hole.
Yeah.
And you get that the whistling that
right?
you call wheezing.
Sure.
Yeah.
But during these times, you ever notice like some people get a cold, an upper respiratory infection, everybody in the house has a resolve, but this person's still coughing like a week later?
Yeah.
They still have that productive, moist cough.
Yeah.
A lot of times it's asthma, and
Really?
they're missed because they're coughing, not wheezing necessarily. But if you're waking up 2 or more times a week because you're coughing, good chance you might have asthma.
Really? That's
And you should be
crazy,
seen
man.
for that, yeah.
Wow.
Okay.
Absolutely.
A lot of people don't know that because
Yeah.
a lot of people in our family used to wake up to coughing and stuff like that, and still do. But you guys,
Well, I was diagnosed with asthma. I mean, I went years without it. It started for me in high school. So I played. I was an athlete in high school. I played a lot of different sports. I played football, and I remember, the first my freshman year of football, I was didn't even know I had asthma, and the practices were it's football practice, it's running, it's insane, exercise and all that. And then played the whole year. I felt like there were some times where I felt like especially short of breath, and I remember thinking to myself, like, I feel really short of breath. I don't know. I must just be
like
that
you're really
tired.
struggling, right?
Yeah, and then it wasn't until the following season I had a checkup, just a regular checkup, going into my sophomore year, and he was saying like, "Hey, listen," he like leaves the room after he did my blood pressure test and he did my breathing, and he comes back and he says, were you ever diagnosed with asthma?" And I said no, and he goes like, "Well, it sounds like you may have this problem or whatever," and they diagnosed me a inhaler, and they asked me to just monitor my breathing, and it vastly improved. And they were like, "All right, well, that's basically it." So I just remember that summer practicing was like, I remember feeling like it's so much like significantly easier when I had my inhaler with me and all that. And it was, but I was like 15 years old when I was finally diagnosed with it. Yeah,
that's what I'm saying. It goes undercut. A lot of times people just be like, you're probably just out of shape.
Right.
You might not be out of shape,
right.
But your lungs just can't handle it.
Yeah.
Right.
And so you should definitely definitely get checked out. So I'll just wrap this area up before we take a quick break, and we'll come back. And I thought we could talk more about what we're doing during this time of year to help us with our own concerns or well-being. So here's a couple just tips for you for if you have those young kids or you're not sure whether it's time to go in to get a checkup or go to that urgent care. Most of the time with children, if you have the flu, most of the time there's going to be GI involvement, either loose stools, vomiting, or chronic nausea and anorexia, and decreased appetite.
Wow.
It typically affects children more than adults because we usually have a stronger consonant, a little stronger GI capabilities. But what you want to watch out for is that fever. That's a problem. They start getting a fever that doesn't break after 24 hours. They have the GI involvement. They don't look good. You should never let a nurse or a doctor, really anybody, dictate what your child should or shouldn't be looking like. Parents know what their child should or shouldn't.
Yeah, right, of course.
They're really the best testament to know whether if your son Joe, right, is excitable and all of a sudden he just doesn't look right. You know what I mean? You know.
Yeah, exactly.
You can tell better than any physician and that's really what you need to go by. And please, for God's sake, use a thermometer. Don't tell me it's 102.5 and you felt it with you hand.
Yeah, that was 102.1.
There's no hand.
2.3. I smelt it.
Yeah,
I smelt his forehead.
I smelt the heat. I get it. You put your lips on it, and I'm not knocking anybody's different ways of doing it, but if you're going to take a temperature, use a thermometer, for God's sake.
Yeah.
If the kid's under 1, I know people like to laugh, but use the rectal. I know, Joey, you were requesting the rectal.
I still do. They stopped doing it for me. They're like, we do it too much often.
Right.
No, it's fine. Listen, I think I have a fever. You were just in here. I have a fever.
It's just about accuracy. Joey, I agree. We need accuracy.
It's the most accurate way. That's
the problem is he likes the rectal, but we don't have rectal thermometers. So,
man, I'm going to find them.
But anyway, listen, the other thing, too, especially during this time, because if you really think about it and make it conscious on your mind, I try to. And I should actually make sure I always carry like a thing of Purell on me.
Yeah.
And just constantly keep my hands, because you're touching, you go to the malls, you're touching doorknobs, you're touching handles, you're sitting in seats that other people were sitting at, you're sitting in seats. And this time of year, people are spreading germs everywhere.
100%.
So the biggest thing is wash your hands as much as you can.
Yeah.
Like if you're on a cruise ship, you say wash your hands constantly. Everywhere you go, wash your hands, wash your hands. Use the Purells everywhere. It's like you can get it anywhere. Carry Purell with you and constantly.
Carry lotion.
When you go in
hands get dried out.
Yeah, the lotion
you can get like an antibacterial hand lotion too now. Like they actually have it where you can get like there's different types of hand lotion that actually has like antibacterial properties, I guess, or whatever.
And you'll notice
it's a little more expensive, but it's good.
You'll notice a significant difference if you do that. You won't get sick. If you do that, you won't. I mean, it will
but then,
really
Rob,
seriously.
there's something about that though. Like if when you rely too heavily on that, I know like a lot of people have said washing your hands too often can sometimes make you actually more prone to developing getting bacterial infections.
Well, if your hands do crack, like Axel Brown said, it's a good point.
Yeah.
If your hands start to crack, you have to be careful because those are areas where you were protected by your skin and enzymes on those skins, and now it's impaired.
Wow.
So that's a good point too. Most people are so far away from water. You've seen them. How many times you got in a movie theater? You went to the bathroom and you've seen like 7 guys walk out. They didn't wash no damn hands.
Yeah,
right. Yeah,
sure.
You see it all the time.
Yeah. Dude, I mean, the worst thing was oh my gosh, thinking about it. So the one thing is I'm not really like I've gotten over the hypochondria thing. The one thing that I've kind of noticed is I'm definitely I'm like a germaphobe. That's sort of I think one of the ways that it's maybe redirected a little bit. Like if I still have a little bit of it, but the point is that I know for me, like when I went to the Giants game, like recently, oh my gosh, of course it's like literally hundreds of guys in the bathroom in there. I am telling you, 99% of those guys go in there, especially because everybody's drunk. They go in there, they pee for like an hour straight, and just turn right around and walk right the hell back out, high fiving their friends. They walk, what's up, buddy? What's
going on, man?
Baby, times.
Yeah, the Giants scored it. Yeah, they're hitting each high fiving each other. But going back to that germaphobe thing, people are germaphobes. Now you see in like fast food restaurants, now they wear the little plastic gloves and stuff when they're touching and handling the food. But if you think about it, if you're worried about them touching your food with their dirty hands, they're touching. They may not be touching your food, but they're touching everything else. They touch the utensils, they touch the trays, they touch the seats, they touch everything. So I mean, you may feel safer because they're wearing those little plastic gloves, and you're not getting it. But you can get it from everything else around you. So if you're going to be a germaphobe, go 100%, man.
There you
know what I mean? You got to think about it.
You got to
all
wear
the
a
time.
mask everywhere. Like you ever see like those people wearing like the masks at the
that's
airport?
that's
Yeah.
a little,
Like
Why
that,
are they always
that's
Asian
like-
now? You ever notice that? They're almost always Asian.
That's something. You know what's funny?
Bird flu. I don't know what's
There
happening.
actually is. This is such a weird
just
fact
gonna be a
that
boy
I
in a
know, but I
bubble.
actually know one little trivia fact about Japan. You know that in Japan it is considered incredibly rude to cough in public. So they people in
well, there
Japan,
you
if
go.
you see somebody wearing a mask, it's because they're sick and they don't want to get other
Yeah, I
people sick.
noticed
It's
that. I hear
considered
that.
like incredibly like
Disrespectful?
Yeah, disrespectful to
disrespectful.
cough in public.
I can't
Yeah.
tell you how many
Interesting.
times I was saying this earlier. How many times I'm like, "Excuse me, sir. I noticed you're really coughing a lot. Could you mind putting on this mask?" And because a lot of times the PSRs up front are just like didn't like doing it. They get all mad. They're like, "I'm not putting on a goddamn mask." Like
Yeah.
it's like if you're taking their sexuality into
Right.
whatever.
Right, yeah,
You know,
exactly. They get all
into
insecure about it.
question.
Yeah, exactly.
It's like I'm just asking you to wear a mask and stop sneezing and vomiting on people. I don't know how
right, exactly.
that became
Stop
a
opening people's
question to your
mouths and vomiting down
masculinity.
their
Yeah.
throats.
and you know,
Sir, will you please stop vomiting down this person's throat?
I don't mean to make everybody feel like so conscious about it, but you just
Yeah.
think, you just keep yourself conscious about touching things and think about people. Like you said, you guys go to the bathroom and then they come out and they shake your buddy's hand, they shake
You
your
should be
hand, they
conscious
shake this
about it. I
person's
think
hand.
that- I think we
You're
should be
shaking
making people
stranger's hand.
conscious.
Nice to meet you for the first. You don't know if that person just freaking
Yeah.
put their finger up their butt or something, and then
most people
and
do.
then
That's-
you know what I'm saying, and then
Like,
shook your hand. You don't know.
Are
You
we
don't
not
know.
supposed to put our fingers up our butts and then shake people's hands?
So
All
I
right,
think,
my
well,
bad. All
I
right.
mean, we do. That's why
Wow.
we're trying to tell you that.
That's why my last
That's how
couple
we
job
greet
interviews
each.
didn't go so well.
That's how
what
we-
happened. I walk. That's right before I walk in. I just, what's up?
We don't have it on camera, but that's normally how we start the podcast, by doing that
Yeah,
just
we do
before we
hey,
start
what's up?
rolling.
Yeah,
Yeah, that's what the
Right
fingers.
up.
yeah.
So yeah,
There's a lot of pink eyes spread that way.
yeah,
That is
yeah.
that's
my
hilarious.
gosh. But yeah, keep those hand sanitizers out, people. Take your health into your own hands. If some jerk isn't going to wear a mask, put a mask on you. No big deal.
Yeah.
You still help protect yourself,
that's
right?
true.
Yeah.
Put your own
that's
mask
a good
on.
point, too, yeah.
And if you, for whatever reason, they don't have a hygiene station, it should have some, some napkins in there or tissues.
Right.
It should have a mask in there and hand sanitizer. If they don't have that, make sure somebody gets it to doing that.
Yeah, of
And
course.
do
That's,
yourself a favor. I know I
know.
mentioned this in the last episode too. If you're sick, don't come to work, please.
That's a big
Yeah.
one, right?
Stay at
That
home.
is a good point.
Especially if you have the
Oh,
flu.
yeah,
The flu's the big one that people come to work with.
Oh,
is
yes,
the
it
You
is.
know, I want to keep that perfect attendance going for
Yeah.
the 7th, for the 20th straight year.
Right. Yeah,
Stay
you're
home.
You're going to keep your perfect attendance and then get
And then get
someone
everybody else sick,
and then
so-
they're going to lose their perfect attendance.
Yeah,
That's
and,
what's going to happen.
and again, I mentioned too in the last one, we work in
It's a
a
vicious
we work
cycle.
in a medical device manufacturing. I make the formulations for those devices, and that person
Right.
comes in sick. You're not only going to, you don't also have the potential of contaminating other people, but you can
product or
contaminate
whatever,
the
right?
products that
Right.
you're working with.
It's
Yeah,
insane.
sure.
And I
too.
know it's one of the rules in my company that if you're sick, you're not supposed to come to work.
Yeah, a lot of
So
people do.
stay
right?
home.
Yeah.
That's it.
Exactly. No, I mean, I interned at that company, and I remember, I was in the front office area, which is still, okay, you're an office worker, but occasionally you walk to the back area and you might interact with people that are back in the labs in the back, and you might shake their hands. You come to work sick too. You've gotten that person contaminated. That person walks back into the laboratory area, and next thing you know, they're, like you said, contaminating some product that is going to be used in a medical facility. It's unbelievable what people will do, even in these companies where literally you need to be like 100% clean.
Totally.
Yeah.
Totally. All right, man. So I think that's going to wrap up this first part. When we
right.
come back, we're going to be talking about seasonal affect disorder. What is it? Is it a thing? And what's LRP doing about it?
All
Catch you on
right.
the flip.
Ooh, that's good.
Hey, Loosely Related podcast listeners. It's 2020, the year of change. We don't care if you're independent, Republican, Democrat, or whatever, as long as you're listening to Loosely Related podcast.
And we here at Loosely Related Podcast thank you for listening to us and appreciate your continued support. Don't forget to like and subscribe on. And where can they like and subscribe, Joe?
Well, if you want, you can like and subscribe on all of our social media platforms, which is at Instagram at loosely_related. You can find us on Twitter at LRPodcast. That's POCASTS. You can listen to us on Spotify, Apple Podcasts, iHeartRadio, and Google Play Music. And you can watch us on YouTube. And if you want, you can always drop us a line at our email, looselyrelatedpodcast@gmail.com.
Yeah!
Hey, welcome back to Loosely Related Podcast. Earlier, we were speaking about upper respiratory infections and just some general guidelines when to go to a practitioner and when not to, and
Right.
things like that. And I think we're going to move on to talk about some seasonal affect disorder, which is so aptly acronymed as SAD.
Yeah, it's sad. It's literally acronymed as SAD. Well, so at first when I was reading about it, I was like, wait, so it's SAD. Are they saying that's what happens when you get it? But no. Yeah, I mean, so this is something that I had mentioned that I wanted to talk about because I know, like, again, we mentioned it briefly earlier, but like like living in the Northeast where we live, obviously, we experience all 4 seasons, unlike some other states like Florida and California and
Bangladesh.
I know, in Bangladesh, I guess, but
I don't know what those seasons
I don't
are,
even know what
actually.
I haven't been there in a long time.
Yeah.
But
Speaking of which, your kids have been calling.
yeah, they have been. They're experiencing Joey missing affective disorder. That's what it is.
Mm-hmm.
But anyway, I think that for me, it's like I'm not a big winter guy. I'm not a skier. I don't do a lot of that stuff like that. So for me, like the winter has always been a time of year where it's always just, it's not like I get super, depressed or anything like that. But it's definitely I'm a summer guy. I really like the summer months. I'm a very active person. I really enjoy like playing a lot of different sports. And obviously I can't go outside as much. My dad and I do play tennis on occasion, and obviously can't do that and stuff. You can't do a lot of different things. Even going to the gym to me is so much harder in the winter when it's freezing cold outside.
Yeah, it's hard.
Just don't want to get out of your bed.
So cold. You don't
want to get in your car
weather.
and start it up and wait for it to get warm and then drive over to the gym and have to walk to the gym carrying your big heavy winter coat and you got to put it, and all that. So
Yeah.
I know I wanted to kind of talk a little bit about how it always seems like, during these certain times of year, people do get sad.
Sad.
Yeah. So and we don't, not that we're not going to make light of things, we probably will.
Yeah.
But
Yeah.
But no, it could be pretty serious. I mean, some people, like you said, are really incapacitated by it, have trouble even getting out of their house or getting anything done, and they can feel overwhelmed. And not just that, they can get moody. I know that's like a common thing.
Really?
And they may not even realize that they're having these type of emotions. Like a lot of people just come across as like. Short.
Yeah.
They're just short.
Short-tempered.
Short-tempered, right.
Yeah.
And short. No, short-tempered, right. And just like quick to dismiss people and they're not really even sure what's wrong with them. So, I think it's something that a lot of people probably do experience and they're not even really realizing that it's going on.
Yeah,
Sure.
exactly.
So, what about you guys? Do you guys have any, do you get issues like that?
Like I said, I mean, for me, I think it's just like I said, certain times of year, obviously, you sort of miss certain things. Like you miss being able to go outside. You miss being able to, take your dog to the park. You miss being able to just, I don't know, even just go for a walk or even just go for a nice drive. So some people just like hopping in their cars and they just drive around for a little bit. And a beautiful day, you put the windows down during nice. And I think I miss those things.
Mm-hmm.
I mean, there's nice parts of winter. Obviously, you look forward to certain holidays in the winter, right? You
Right.
have like Christmas and things like that. So there are those nice aspects, but I think that's something I just kind of do. I miss a lot of the things that I can't do anymore because it's so cold out and because of the snow if it's snowing out.
Well, you can keep yourself occupied because you play those games with your friends. So at
I
least you have
do
that to do. And
I have
like
indoor
the
activities
online
that I do.
games?
That
Yeah,
probably,
yeah. Like the video games we talk about.
fights
stuff
off
like
the
that.
doldrums a little bit,
Sure. Yeah, for sure. Absolutely.
I don't know that I get any psychological effects from the season,
Yeah.
but I do get. I think I tend to get more lethargic because you have a shorter day. It gets dark early.
True. That's a
Right.
good
A lot
point.
of
Just
times you
like-
leave to work, it's dark.
It's
you
dark.
come home,
you come home,
it's
it's
dark.
dark, or almost
Right.
just
Right.
about getting dark.
Yeah.
And that's that can be depressing a little bit, I suppose.
There's
but,
a lot to that too, even just the things that you get from the sun, like vitamin D and stuff.
Yeah,
Right.
exactly, right.
Right.
And what I try to keep you mentioned the dog. My dog keeps me active. I used to
Right.
have kids when you were younger. You guys kept me active. I'd go sleigh riding with you guys, and maybe we could do that in between. We'll go sleigh riding.
Yeah, we'll go
Sleigh
sleigh
riding.
riding. Yeah.
But yeah, I used to go sleigh riding with you guys, do all those kinds of things.
Yeah.
And it kept me active. Now I have my dog, and I bring her. She's very active, Molly,
Yeah.
and she likes to go out and she likes to run around.
Right.
And I try to, I usually play ball in the summertime with her. Now I
Yeah.
play snowballs in the wintertime with her. So I throw the snowballs, and she goes running through the snow to get the balls. And,
Yeah.
and I take her for walks, even in the winter. I don't care. I'll still take her to the
Yeah.
park and trudge through the snow with her because
Right.
she enjoys it still. So.
Well, it's kind of funny. I feel like speaking about our dog, I feel like even sometimes animals can even feel the difference. I mean, in that, she's definitely aware of the fact that she doesn't get taken out as much outside when
Yeah,
it's
she told me
freezing
that
cold
earlier.
out. Yeah, well, I mean, besides the fact that she actually complains about it all the time and never
Right.
shuts up about it.
Yeah.
I think she can actually just generally tell. But it is kind of funny you mentioned the whole daylight, like the light time, having shorter days and all that. Like Rob, I'm sure you're aware of this, but I guess they're not sure exactly what causes seasonal affective disorder, but it seems like, I guess, like the leading theory is that it could be related to the reduced exposure to sunlight that occurs in the winter, and that, a lot of what they, think happens is that your body clock is thrown off, and people are not sleeping as well, and your sleep, all that is getting thrown off, and obviously that's a lot of people, your sleep cycle gets thrown off, and you go through mood swings and changes to your personality like crazy.
No, it's true. I sometimes even in the summer get like I get FAT disorder because I don't want anybody to see my blubber on the beach.
FAT,
FAT.
Sure.
Yes.
I usually do the hibernation thing. Yeah.
Right.
Yeah.
But no, speaking of the light thing, they actually they do have a I forget what exactly they call it. I have to look it up, but they have some kind of light therapy. I'm not sure exactly how it works, but it's supposed to treat
Really?
Seasonal affect disorder.
No way. Okay, that's really cool.
So they have light therapy, and they say it may improve symptoms.
Would that be like a tanning bed kind of thing, or almost like, or like that'd be kind of interesting, right? That'd be kind of funny if you were to just like do a tanning bed all winter.
Yeah.
I mean, I know some people do.
They say treatments include light therapy, phototherapy, talk therapy, and medications.
Really?
Oh, okay. Oh, wow. Yeah, that's good.
Interesting.
But like I think we were alluding to this earlier, one of the things that people may not realize is like most people, I know there's going to be some Grinch out there who's going to be like, I love being alone. But most people really do crave socialization.
Right.
And that also sometimes decreases in the winter months, right?
Yeah,
you don't get
sure.
together as often. You're not having the bonding that you normally would. Even they've actually proven in a lot of studies, people in the hospital sometimes won't eat as well because it's a socializing for them. They eat better when they're around their family or loved ones or friends. Yeah.
Wow.
So it affects a lot of things. So one of the things that I like about this podcast is it's something for me to look forward to.
Yeah, sure.
So I come and I see you and Brian and your dad and everybody, and we chit chat and we have and we have this nice thing going together. So
yeah, for sure.
So hopefully we're producing some happiness out in the ether too.
Yeah.
People have something to stuff in their ear holes.
Right.
Listen to us gabber on for for a couple hours.
Yeah.
But no, seriously, this is one thing that really helps me at least.
Yeah.
Like we commit to it, we make sure we do it, and then like even Joe was saying, like he's building the setuap and all that.
Keeps
So
it busy.
keeps you busy and keeps you something to look forward to.
Yeah.
Right.
Especially in the seasons, you get some people who are like, they I know, I don't want to go too into people's personal issues, but I know someone very close to me who does terrible during the Christmas season. They just are always kind of just depressed during that time of year.
Right.
Yeah.
So, and some people afterwards feel like, oh, well, Christmas is over. Now we just have 3 more months of winter crap.
Yeah, right. Right, exactly. Yeah.
Sure.
I feel like there is that to it, right? Like there definitely is something about like that. The holidays, end, and then there's that sort of depression, like, oh, now we just got to look forward to like nothing until March or whenever the hell the sun comes back and you get to have nice weather and get to go outside and all that. But it's kind of interesting. I was looking up a few different things here, and it turns out, I guess, like apparently 3 out of 4 people who suffer from SAD are actually women.
That's more common,
which is kind of interesting. I don't like it does say that men can sometimes experience more severe symptoms, but it's just kind of
Probably
fascinating.
because we complain the most.
Yeah, exactly. I bet.
My wife's
Right.
always like, you can never have a baby, you complainer.
Yeah, exactly.
Right.
I do complain.
I complain.
I'm like,
I complain all the time.
Stephanie,
Yeah.
come in here and hang out with me. It's
Exactly.
just pathetic sometimes.
I think it's hard. Like I know, like me and Brian were talking about, like we try to exercise as much as we definitely can, and I feel like that's one of the reasons why I think during the spring and summer I know that I'm in a better mood because I am able to exercise more, and not necessarily like I have to do it outdoors. I can still exercise here. Like Brian and I have talked about different kind of exercise routines, and I still do like like high intensity interval training, like plyometrics. You can kind of do like in your room, in the comfort of your own home, in your living room, wherever. And
That's how I do all mine.
Yeah, and that's helpful. But I think there is something to like kind of getting outdoors, like and going for a run, like doing something like that. And I think during the summer, being able to do that, just that one thing, like you realize when you don't have that one thing in your life anymore, it is a monumental change. Like just not being able to do that one type of thing, that exercise or whatever. It's
so hard in winter because you really are limited to the time you can do it. 'Cause
Right.
at night it gets so freaking cold.
Exactly.
Right.
Yeah.
Yeah.
Do you guys ever have you ever considered, we're all in our adult, I know we're in different generations, but
Yeah.
we're all in our adulthood as far as I
Yeah.
can tell, right? I think.
Yeah, I think
Yeah,
so.
you guys ever-
For the most part, yeah.
And you guys ever thought about like moving to a state or another area that's like, summer longer and stuff like that, or?
Someday maybe.
Yeah, I think you've talked about it before, right?
Yeah, maybe. I mean, of course, the big states are, in retirement are like Georgia and Florida and those places down south.
Right.
Probably go somewhere like that.
Yeah.
North, South Carolina, Georgia, Florida.
So like for
maybe
retirement?
Texas. Yeah, retirement possibly. Yeah, I'm definitely not staying in New York when I retire. If I retire, but yeah, if I retire, when I retire, yeah, I'm definitely going to be going down south where it's warmer.
Yeah.
But I will miss the winters for like Christmas time.
Yeah, exactly.
Yeah,
Exactly.
it's something
I'll
weird
miss-
like
I'll
when
miss
you see
a
it and
certain
it's
point, I'll
warm,
miss it.
right?
Yeah,
All
there's
the white
still-
Christmases we don't get.
Yeah, that's true.
exactly.
It's when you think about it, it's really rare. I think
Yeah.
I could probably count on my one hand how many white Christmases.
Yeah, exactly.
Yeah.
I mean, maybe if we were up closer, like Buffalo or something like that, it'd be a little different. But
Get that
obviously
lake
down
effect.
here, yeah,
Yeah.
exactly.
Has anyone here ever had a Christmas in a warm one? I've never been anywhere warm during Christmas.
No, I've never. The only
Nope.
holiday that I think I've ever I've never really gone away in the winter time. The closest I think I ever came to it was when we did we did one year. We went down for I think we all went down to Florida one year, and it was kind of like the end of August, so you kind of come back, and it's almost like fall, and it's like so much warmer down in Florida, and you come back up here, and it was just starting to get to fall in New York, and it was like maybe starting to hit 60, 58, right around there, and that's a major difference going from Florida where it's so humid and all that. I just remember that was the first time it hit me. I was like, wow, they're the difference in the climates is so just vastly different, in
Right.
certain places. It's crazy,
Yeah, I lived in Virginia for a number of years when I was in the military, but to be honest, it's not that much warmer. I would say there's less precipitation as far as snow.
Okay.
So
Yeah.
it's maybe a few degrees warmer there on average.
Yeah.
But I would say it just feels like there was less snow there. But when there is snow, it's like it's like 5 alarm around there. Oh, shut it
Yeah,
down,
right?
everybody.
Yeah.
Bread and eggs are being sold out. I'm
Yeah,
like,
yep.
what are you going to be in your house for a month? What are you doing right
Remember
now?
when there was that one snowfall in Texas? I forget when it was, but there was it was like half an inch, and people
like War
were
of the Worlds.
freaking
Yeah.
out.
Yeah.
What is this white
No, they're-
stuff?
they're
I've only heard
definitely
rumors.
not used to it.
The sky is falling. There's all this crazy stuff. I remember that.
Yeah, I don't know. I guess what keeps us here in New York right now is it's certainly not the great tax rate.
Yeah,
I mean,
definitely not.
I guess it's because my family and friends are here and I have kids.
Yeah.
Right.
So I don't want them to not see their grandparents and stuff that often.
Right.
Yeah.
Exactly. Yeah.
People get older, you don't want to miss out on.
You don't want to miss out on
times.
things like that.
Brian, you
Yeah.
lived in other states, right?
No.
No,
Well, you lived
well,
out
in
in LA.
college.
Okay, so in college,
Yeah.
I lived in Boston and I lived in Los Angeles.
Right. Yeah.
Did you ever spend Los Angeles during the winter times, or you were there?
Yeah,
during
so
the
I
fall?
was
Okay.
there in January and February.
What's it
Right,
like
right.
there?
It's fine.
Yeah.
Is it warmer there? Or?
During the day,
Give us
yes.
something, Brian.
Yeah. We
Give
got
us- It
During
was good.
during the day, it's like 60, 70. But at night, it gets really windy and really cold.
Yeah. Right.
But like 40-degree cold, but it doesn't feel like 40-degree cold.
What do they call it? Like the Santa Ana? Isn't that like that? There's that
Santa Ana
that
winds?
wind thing that comes through California every now and then.
Yeah,
It's
sure.
like something
Yeah.
like that.
That sounds good.
It's something like
Brian,
that.
you're the fat guy. Is that what it is?
Yeah, there you go. But
Just we're just making things up. They got monsoon season there.
monsoon, isn't that when they get what is that the Paul Giamatti storm? Paul
Monsoons, they
Giamatti
barely
just
have
running
water
around.
over there.
Well, so how long did you spend over there? A couple years, or
3 months.
oh, you were only there for 3 months.
Yeah, one semester, right?
Yeah.
Oh, you just did a
Yep.
semester.
Yeah, I
over
spent
there?
3 years
Oh.
in Boston.
Yeah,
That
Right,
was
yeah.
the majority.
Yeah.
Oh, so that weather obviously similar to
It's
us.
literally us.
yeah.
You had to go
exactly.
out in the winter in pocky car.
Well, they get worse storms than us sometimes
Yeah.
too. Like they had that one storm. What was that? Like
People were like
couple
jumping
years
off
ago.
their
Yeah.
houses. And
Yeah, they were like jumping off into the snow.
Did they
It was
finally
insane.
finish that big dig?
Yeah, the big
what?
dig.
The big dig.
What is
You don't
that?
remember? They were doing that whole Boston for that construction was going on for like a million years. The
Really?
big look up the big dig,
The
Brian. You know
big
about
dig. I have no idea what that is.
that? Well, listen, I haven't been in Boston in a while, but that was going on forever.
Really?
They're like, it's gonna increase like width
the
and-
Central Artery Tunnel Project
Yeah.
in
Central
Boston.
Artery-
Oh yeah, I remember that.
Oh, I don't-
That's been going
I don't
on
know.
for a long
that was
time.
Sure,
going
yeah,
on
why
for.
not?
Is it still going on? Do we know? What
Yeah,
is
why
that?
not?
Central
There's that,
Artery.
and then there's the monsoons that go through it,
Yeah, of course, all the monsoon. Everybody's getting
and
monsoon.
the Santa Ana
It was
winds.
completed in 2007.
Wow. All right. There you
Listen,
go.
to be fair, I was still away in the military.
Rob
during that
hasn't
time.
been to Boston since
No, I
like
haven't.
1957.
Actually, the
so-
last time I was there was 2007. I was in some. Oh yeah, that was. We could keep that story for something else.
Yeah.
It was the Lucky something bar. I don't remember, but
I don't know, man.
Yeah, things happen there.
I know.
I probably even shouldn't let them know I'm still around.
You know what's funny is I do think like one of the things, not to completely derail our derailment.
It's already
but,
derailed.
What I was going to say is I know like one of the things I did want to touch on this one thing is I do feel like exercise is great. Everyone always talks about that. The one thing that I think is not really talked about enough is like diet, and I think that a lot of people need to focus a lot on the fact that what are you putting into your body during these times of the year
Double
that things are getting bad.
Yeah.
You're doing things that are like you're putting a lot of like really crappy carbs and eating a lot of sugar and a lot of things like that.
You bring up carbs.
Yeah.
I want to say this.
I love them.
Yeah, because it's really important though. Because a lot of people, they say, I'm going to go no carb diet.
Yeah.
Don't go no carb diet. Go low carb diet.
Yeah,
Because it's not sustainable to do a no carb diet.
Right.
And you do need carbs. You need a certain amount of everything.
Exactly.
Yeah, sure.
But it's really like when I say diet, I think we all like think it's not really that, right? It's a lifestyle.
It's a lifestyle.
It's a lifestyle.
Yeah. Like I mean, I've talked about it before. I've done the intermittent fasting thing, right? And to me, that like I don't even consider that a diet. I just consider like that's my new way of life. That's how I eat now. And it's, I do my regular fasting.
I think that's
and
one of those
what it
ones
is.
you actually can get. It's a diet you can actually get used to. Your body will actually get used to that.
Oh, for sure.
How long have you been doing that
100%,
now,
man.
the intermittent?
So I mean, I started like my weight loss September of last year. Actually now I guess it would be 2018 actually. And I've been doing this. I would say probably since I would say I really started getting really into it in October of like 2018. So it's been over a year now that I've been doing that, and it's been monumentally helpful, not just for my like physical health, but I think like my mental health too. You
feel better about yourself.
Yeah, exactly. Yeah, and I think like the one bad thing I used to always do is eating late at night. It wasn't just bad for my physical health. I remember I would eat, and then I would just get like the acid was bad, but I feel like I would get like lethargic, and I would get like kind of almost like
coma,
almost like like a depressed kind of thing because you're eating late at night, and then you feel guilty because you did something that you're probably not supposed to do. And I don't know. I didn't like that.
Dude, I did go on Facebook the other day and I saw a before photo and I was like, wow, I didn't realize how much weight you lost.
Yeah, I know. It's dude. I mean, it got to a point where I was
pretty funny. We get some good laughs out of it.
Oh, I get some hilarious laughs.
Joey
cracks.
It felt like such a short period of time though, because I was hanging out with these two characters at their spot over there, Buffalo Wild Wings, the B-Dubs.
Yeah.
And I mean, I noticed Joey had gained some weight, but I didn't think that much about it. And I could swear, like, I knocked on the door like a month later, and it was like some other guy.
Yeah, like, what the
it
hell
felt
is
like
that?
such a short period of time that he lost that weight to me. I was like, holy crap, how
I
did he
should
lose
have
all that
gotten
weight?
credit for
It
that
did
diet,
happen.
man. I
It
should
did
have jumped
happen
on
pretty quickly. You know,
Felt like you really shed that pounds quick.
It all kind of happened. Like I don't really talk about it too much, but like what really kind of got me into it was like I had actually gone to the doctor, and I remember I'm a young guy still. I was 20 at the time. I had just turned 27. I'm at the doctor. I had high blood pressure that day, and I just thought, oh, well, I did kind of have coffee not too long ago, so whatever. But it was like higher than like what I guess it was way supposed to be. And the doctor, when he came in, they took it twice, and it was high both times. The doctor comes in and he's like, oh, talking to me, whatever. And then at the end, he's like, oh, listen, we're if you want, I can maybe we could start you on some blood pressure medication. And I'm like, I'm 27 years old. You want to put me on blood pressure medication?
Hey, that's
so
crazy.
I guess
eye-opening, right?
Yeah, he was looking at my weight, and he said, I've been this weight for a while now, and maybe he was just in his mind, he's a doctor. Maybe he's seen a lot of people not be able to lose weight.
Sure.
And I get he's doing his job, but it really freaked me out. I was like, really, man, that like it was a real eye opener, and that's kind of is like sort of like the kick in the ass that sort of got me to like, all right, like I gotta stop just saying I want to lose weight, and that's what kind of like I had to do something. He wanted to put me on the DASH diet, which is like he wanted to reduce my heart healthy and all that, and I was like, oh my goodness, this is not good. So. Yeah, I think it takes that kick in the ass sometimes. I think.
Definitely, it makes eye opening.
Yeah,
and it tells you a little something about like the way we view things as like deciding to maybe do medication before talking about natural lifestyle changes.
Exactly, man. Yeah, for sure. I didn't want to get put on any kind of like a diet pill or anything.
I remember when he was talking to me about doing. I had a doctor similarly tell me he's like, he's like, Rob, if you can't like drop a little bit of weight or if you can't get your thing, but I was actually lighter then, but I think for me it was mostly related to stress.
Yeah.
And I was able to reduce my blood pressure again.
That's awesome, man. That's great.
But I know, like that. Joe, you got pretty good blood pressure.
I was just gonna say your blood pressure.
My blood pressure.
He's a little genetic.
He is. But the one thing that you've been kind of having issues with is cholesterol, right? You've like a couple times
I'm getting
you went
more
to the doctor
concerned
recently.
about I've always had
high cholesterol.
Cholesterol on the lower end of the high spectrum. I guess it's right.
It's elevated, but not crazy.
It's not like crazy high. It wasn't.
I think it was.
A lot of times that's genetic predisposition.
210. Does that sound like?
Your I think your total should be under 2, if I'm not mistaken.
Yes, and I think
Yeah.
I have like 210 or 220, and
Yeah.
that basically
150.
my diet is not.
Yeah, you eat
it's-
snacky
it's-
cakes.
That's the
it's- I
problem. Your
got
diet's not
Cornelius.
good. But you do have good genetics.
But
for
he's
sure,
like looks
100%.
amazing.
Yeah,
Yeah,
no,
Guy doesn't-
I
it's
really
frustrating. For
Yeah,
you,
it's
even for me,
annoying.
being his son is even more frustrating because I'm like, why don't I have those
Yeah,
freaking
right.
genetics?
I'm eating little Nemos for
exactly.
dinner.
But you will, like I said, the way you eat now, and I wish, like I said before, I wish I had jumped on and ran with that idea for the intermittent diet, because that's how and I know I mentioned this before, I eat like that normally,
Yeah.
and I always used to say to everybody, eat like I eat and you'll be
Yeah.
fine. So like, the thing with my, the diet thing, I try to eat in the morning, and hopefully maybe it'll help me gain some weight, but
Yeah.
But going back to the cholesterol thing that you were saying, is that my diet, I'm trying to get away from like the steaks. But you mentioned to me it's not the steaks. The steaks are not the bad
I think
cholesterol
it
you're getting.
depends, right?
It's all the other sweetie stuff that I'm eating,
Oh,
and
well,
butter
yeah.
and sugar
For you,
and
it's all
cream and
simple
all the
sugars,
dairy,
right. I would
the
definitely
dairy
work on that
products and
before
things
work.
like that. It's probably I probably have to
Right.
it's probably
But-
better that I cut those out of my diet rather than steak.
A lot of
'cause-
times it's genetics, and it also depends on your ratio of cholesterol.
Right.
Okay.
Or your LDLs, the low density lipoproteins, where they need to be, the high density lipoproteins, and they can actually do a ratio and tell you what it is more like, is what the genetic disposition is, and what is it most likely is affecting it.
Yeah.
Like
Yeah.
the doctors, I think we all see the same guy. He'll go all into that.
Yeah,
Yeah.
exactly.
Yeah, he's excellent.
He is really great at that. Yeah, I think for you it's mostly like the ice cream and all that.
I have a
You
lot
do,
of
you do a lot of
my
the
diet's
sweet, you,
filled
Snacky
with
stuff.
sweets.
Yeah, but you have a sweet tooth.
Yeah, oh,
100%.
huge.
100%.
I live off
That makes me think of that
Yeah,
Jim
exactly.
Gaffigan.
Jim
Your
Gaffigan.
tooth knows your ass an explanation.
Anyway, but yeah, so I mean that's something that like you had that, and I had like I feel like everybody kind of has that one vice. Like I definitely I loved salty foods. It's
That
probably
one-
part of the reason why.
One vice,
Crack
Yeah,
cocaine.
You're right.
just
one vice.
That's yeah.
I just
Loosely related
that crack
podcast is my
cocaine has
vice.
got
How
me.
about that?
Crack's a hell of a drug,
stop.
man.
Yeah.
That
Let
crack-
your vice be loosely related
No.
podcast.
Yes.
Yeah, that's a good vice.
That's what it is.
That's a good vice to have. All right, so we covered a lot of topics today. I hope you guys learned something. I know we went over like all different aspects of health. We just wanted to give you guys a little idea, into the new year, what kind of things that might be on your minds, and hopefully we gave you some little tidbits that might help
I think
you out.
we definitely
Help. Some
did.
good
I think. I
information,
mean, even
sure.
myself, I learned a lot whenever we do these types of episodes, just about health in general.
Yeah.
So it's good.
Well, so what you got for us, Joey? Anything good?
Well, I mean, I think for now, you guys, I appreciate everyone tuning in for 30 episodes. It's crazy that we've gotten
crazy,
this far.
man.
I
It's
appreciate you guys sticking around for as long as you have, as we always say. I
And wait,
guess you can always
wanna-
do the same
I wanna-
thing. Oh, here we go.
break
He's
you up.
yeah.
Yeah.
We're going to open up a loosely related healthcare center.
Oh, God.
Now that you guys have, we have more information. We'll have
Yep.
Rob as the nurse. We'll have you people come in. We'll
Yeah.
give you medical advice.
This
That's a good idea.
This
Pro
is
bono.
not correct. Again, going back to that disclaimer, you ask your physician about any kind of changes you might want to make in your life.
Exactly.
You got anything else, Joe?
No, we're good. You can continue with the outro.
I'm all good. If you guys are all good, we will see you next time.
Peace out.
Bye.